Yes, hi, my name is Vince Diller, and I'm going to be doing my presentation on nursing image. The objectives of this presentation is to summarize the importance of nursing image and to understand how healthcare is affected by nursing image, and also learn about how nursing image impacts society. First, the importance of an image. An image is the way a people or a profession appears to society and other professions. It is just the face. How do people see us as nurses? And the impacts of that image are huge. The image of nursing is used to recruit students, our public view or view in public, funding for research and education, relationships with healthcare leaders and administrators, relationship with government agencies and legislators, and also self-identity. How do we view ourselves? People usually have a positive experience with nursing, but they don't understand or see the whole picture of nursing. And we see that in the Gallup polls in 2017 marked the 16th year straight for nursing as the most honest and ethical profession, which is something that we should celebrate for ourselves as nurses. Next, I want to talk about the influences on nursing image. I think one major thing is self-identity. How do we see ourselves as nurses? Do we see it as a good thing, as a negative thing? Like, how do we talk about our own profession to our friends and our family? Do we celebrate what we do, or do we complain about what we do? And if we complain, does our complaining nullify our compassionate care? Are we putting on a fake face in front of people to appear and act a certain way to improve patient satisfaction? To change how we view our own profession and our own work. If it doesn't begin with us, then society will continue to see us in a different light. Another influence is media and advertising. Media usually shows the caring side of nursing, but it neglects the knowledge and the competency that we have. Here to the right is just an old advertisement encouraging people to go into nursing, but I don't think it would do a good job now to attract people to go into nursing. So I don't think it would be too attractive to males or people from different ethnicities. Another way that, another influence on nursing image is the government. The Congressional Nursing Caucus in 2015 supported a campaign called Nurses, Their Vital Role in Transforming Health Care, and it just highlighted that nurses are the backbone of healthcare. So what is missing from our image? I think it's knowledge and clinical competency. Society knows that we care and are compassionate, but it does not understand the knowledge nor the clinical competency that nurses have, and I'll talk about why that's important in slides to come. The benefits to healthcare and to nurses with improving nursing image is changes in healthcare policies. Nurses are on the front line of healthcare, and we need to speak up about policies that need to change, that need to be altered. We need to have a voice in the government. We need to have our voice with legislators. We need to know that we have a powerful voice, and we can use it, and we should use it. Like now, we all wrote to the senators about something that needs to change, and one of the most important topic that we probably all talk about was staffing. How staffing is terrible in the hospital, and it's something that needs to change. It's something that needs to be continually talked about and brought up. Another thing is changes in hospital policies. As nurses, we need to continue to advocate for ourselves and advocate for the safety of our patients. That nurses are usually the forerunners of evidence-based practice and incorporating that into care and into our policies. Another thing is changes in wages. If a bachelor's is required and a bachelor shows that we're more professional, we should get paid more for that. And at Lancaster General, within the past year, they heard our voice. And if you have a bachelor's in nursing, you're going to get a pay raise, which we all celebrated. And then the impact on society. I think it's improved patient outcomes. More nurses that are compassionate and clinically competent means improved care all around, and this improves the patient's trust as well. With being more professional, we also have more of a dress code now. If you're nurses at LGH, you wear blue, and nurse aides, they wear green. And these clothes just they're just easier to spot and identify nurses. And also just that in the past, nurses used to wear scrubs, that had cartoon characters on it and all that, but now they have organized our clothes and made it look more professional, and that it's not like not as silly or a joke per se with walking around with Goofy or Pluto on your scrubs. And also another impact on society is less stereotypes. If you look to the right, this big stereotype in nursing, which is annoying, is you're a white, beautiful female who's attracted to the doctor that you work with. Hopefully with nursing, there'll be less of these sexual stereotypes as we become more professional and have more professional encounter with patients. To summarize, the nursing image and our professionalism is important. The majority of workers in healthcare are nurses, and nurses should want control over our own image. We have the capabilities and the power to improve our image. Because it not only affects us, but it affects our society as a whole. And here are the references I used. Thank you for listening.